welcome everyone. I'm Marcy Gallagher with Mountain Pacific here with my colleague Jolene Kageyama, and we will be presenting today on Quality Improvement Basics, What You Need to Know. So for those of you who don't know us, Mountain Pacific has been around a while, since 1973 actually. Our corporate office is located in Helena, and we provide expertise, collaboration, support, data analysis, and more to healthcare providers, practitioners, and a variety of other clinical and non-clinical partners. As a nonprofit, we work with federal, state, local, and commercial organizations to provide solutions for better health. Some of you may know us as a Quality Improvement Organization, or QIO. So we are extremely fortunate to collaborate with Liz Davies and the team at Montana Healthcare Foundation to conduct a Quality Improvement Basics course, which includes a 6-part webinar series. So we will be offering a webinar every other month, as well as providing one-on-one quality improvement assistance with grantees and access to our recently developed Quality Improvement Toolkit that you should have all received from Liz, along with a couple other attachments yesterday. So if by chance you don't have that toolkit and attachments, just feel free to drop your name and email in chat, and we will get that sent over to you. So just as background, in the spring of 2024, there were 22 current integrated behavioral health grantees who completed a self-assessment using the Comprehensive Healthcare Integration Framework. And Liz noticed that almost half scored a 0 out of 3 for that quality improvement domain. And getting started was a key action item grantees felt they needed the most help with. And that's how the Quality Improvement for Integrated Behavioral Health Learning Community was born. And we hope this series will help you not only start to implement quality improvement in your practice or organization, but to also sustain that work. So Mountain Pacific is really excited to be here and help you with your quality improvement journey. So at this time, I'm going to turn it over to my colleague, Jolene.
All right. Thank you, Marcy. Everyone can hear me well. So Jolene Kageyama, I'm a licensed nursing home administrator. I live here in Honolulu, and I'm very grateful that I've been invited to be a part of your workshop. So today is just kind of starts off the agenda, what we're going to be focusing on today. It is content heavy today. And, you know, as Marcy mentioned, Liz had forwarded to you the Quality Improvement Toolkit, which should have been on your email, and some other extra tools that we developed that you might find helpful when it comes to quality improvement. So today, this is kind of where we're going to start. But before we get into it, I want to do a polling question. So, Maynette, can you pull that polling question for us? And the question for the audience is, how familiar are you with quality improvement? I'm very familiar, expert, somewhat familiar, or what's quality improvement? So you take a couple of seconds to click on one of those and submit. I'd appreciate it. Okay. Are we seeing the results? Are you folks seeing the results? Okay. All right, so good. So 75%, it looks like we have 8 responses. Anybody else wants to chime in? Okay. So it looks like about 3/4 of you are somewhat familiar with quality improvement. That's great. And 25% said, what's quality improvement? So I look forward to sharing some of this with you today. All right, Mina, if you want to stop that poll. Okay. So today, our objectives here for the next hours is focusing on introduction to quality improvement, how to set up your first quality improvement project, building a culture of continuous improvement, because that's really the key when it comes to quality improvement, is being able to sustain it, and then tools and resources. Next slide, please. This is just a picture of what was sent to you from Liz. And it's about, I think it's about 16-page document, and it's set up like a workbook. So you'll be able to utilize that with your team in developing your quality improvement. Next slide. So here we're kind of just talking about what is quality improvement. It's not about being perfect, but it's about making steady, meaningful progress towards better care. Sometimes quality improvement is also called performance improvement. Again, it's a process to help standardize your healthcare delivery processes, reduce variation. Again, continuous. It's purposeful. It's measurable improvements in healthcare. And it includes continuous efforts to achieve stable, predictable results to improve processes and outcomes. Next slide. I forgot to mention in the beginning, if you have questions, don't hesitate to drop them into the chat. We're going to try to address those questions towards the end of today's session. And then we just threw in this little quote here from the Institute of Healthcare Improvement, IHI. All improvement requires change, but not all change results in improvement. Using a quality improvement methodology can ensure the changes you make, provided the changes that you want. Next slide. So goals today, we want to talk about goals in quality improvement in healthcare, enhance your patient or your resident safety, reduce errors, improve clinical outcomes, streamline your workflows to increase efficiency, reduce costs, meet regularly, meet accreditation standards, foster a culture of accountability and continuous learning. So these are just some of the goals we put together in today and quality improvement. Next slide. So let's get started. So what's important in quality improvement is being able to define what the problem is. What is it that you're focusing on in your community or your clinic, and see, what that is and how we want to address it. So for discussion purposes, I'd love if anybody would like to come off mute. Who's gone through these steps of quality improvement? And if you have, where do you get stuck? Anybody commenting in the chat? Checking the chat.
I
Anybody
have, my thing is starting at the beginning, just kind of trying to find what your true goal is to a small enough obtainable goal that makes an impact.
Okay, so you get stuck at starting right at the beginning.
Yep.
Okay. And being able to define what that problem is.
Well, you know what the problem is, but how to break it down so it's small enough to make it obtainable, where people will get the buy-in so that you can increase it even more.
Okay, how to break it down. Have you been involved in a root cause analysis before?
No.
Okay. So later in this session, I'm going to break down, I'm going to take you through an example of a provider that we worked with that was seeing an increasing number of informal patient complaints regarding their experience. So I'm going to kind of walk you through what we did and go through a root cause analysis to kind of spark some interest in your particular area, where how to get started from the beginning and how to break that down and go through a root cause. And in my practice as a nursing home administrator, I just kept asking the question why until we got the right answers that we needed to hear. And so we're going to be going through that today. So I hope you find that helpful. All right. Anybody else? Anything else that you've done in any of these steps, or where you get stuck? That was a really good example. Thank you. All right. Okay, so here, these are basically your steps of quality improvement. We're going to define the problem. We're going to conduct a root cause, setting a clear aim statement, forming your team, and going through a PDCA, or sometimes people call it PDSA cycle. And then the most important thing, I think, at the end is once you've done that, is build that continuous improvement. So we're going to talk about each of these steps. So you have to define what is the problem, identifying a specific issue that you want to address, articulate why it matters, and then set a foundation for that QI initiative. You want to take, maybe you have a ton of problems you want to focus on. So let's prioritize them and look at what's the high risk, high cost, high volume, or problem prone areas. And that way you can kind of narrow it down and streamline it to that. From there, you're going to conduct a root cause analysis to really dig deep and determine why. Why are you having that issue? You can use the tools like a 5 why, and I'm going to take you through that example shortly. There's also another tool called the fishbone diagram. And I think in Liz's email to you, we gave you a couple of samples of the 5 why, which I like to use personally, but we'll take you through that today. We're also going to set a clear aim statement. This is a summary statement outlining your team's goals, the specific change that you aim to accomplish, and the period in which you want to achieve that. You can also use SMART goals. Some people are very familiar with SMART goals in defining their aim statement. In the toolkit as well that we gave you, it takes you through those examples too, in helping you define that aim statement. So, for example, we want to reduce resident wait times from 25 minutes to 5 minutes during peak hours of maybe 5 p.m. to 7 p.m. over the next 3 months. So that's just an example of what an aim statement would look like. It's very specific. It gives a timeline and the specific change that you want to see. And then we're going to form our teams. We'll talk about how to form those teams. And then you're going to test those changes that you're going to make through a PDCA cycle. We'll evaluate, sustain it, and build continuous improvement. Okay, that's our plan for today. Next slide, please. And again, let me reiterate, if you have questions, feel free to drop them in the chat, and we'd like to address those as we go through. So defining the problem, this is you're developing your call to action. What is that problem? How do you break that down? So here we gave an example. There's an increase in informal patient complaints. This is a provider that we worked with in helping them identify what their problem is, identifying a specific issue you want to address, and articulate why it matters. So as we said in this example, informal patient complaints, kind of jumping ahead into the root cause, but we want to set that foundation for the QI initiative and then prioritize. I think we can go on to the next slide. Okay. So here is the root cause analysis, and this slide is kind of busy. You may not be able to read all of that. If you have this on your computer, you can pull it up because we gave you a sample of this. And this is the 5 why or fishbone tool to identify, identify your root cause and define the problem. So in that, it's kind of tiny, but I'll kind of take you through the example of this format of the 5 why. This provider had received an increasing number of informal patient complaints regarding their experience. So why is that? Why were the patients complaining? They reported that there was long wait times. They felt rushed during their appointments, and there was poor communication between the patient and the staff. Why is that? Why were they having that? Why are these issues occurring? Now, the provider is running behind schedule. The staff is overwhelmed, with administrative tasks and the patient inquiries. Okay, so why is that? Again, we're continuing to dig deep with your team to find the root cause of it. So when we asked further, why is it? Why are you running behind schedule? The appointments are overbooked. There's no structured approach to managing the patient flow and the expectations. Okay, why is that? Why is there no structured approach? The practice has never systematically collected patient feedback to identify the pain points and make data-driven improvements. Why is that? Why has the practice never collected feedback? Well, they answered that there's no formal patient satisfaction survey or feedback mechanism in place. Okay. So through that group and that team that we worked with, we were able to see, without having a satisfaction survey, they're not sure where they need to address. So their root cause in this example was that they needed a patient satisfaction survey or a feedback mechanism to have in place. Next slide. So here we have identified their root cause. The provider's practice had never conducted a structured patient satisfaction survey, which led to a lack of awareness about operational efficiencies. Without the patient feedback, the practice had not been implemented necessary process improvements to address the long wait times or the communication gaps and the appointment scheduling issues. So as you see through the 5 why process, we were able to help break it down, identify that root cause, and then from there, what's next? What are we going to do now that we've realized that this is the root cause of the situation? What's next? Well, we want to develop that aim statement, which is that summary, very specific aim statement. And different examples that might pertain to you in your practice, and we also listed them some in the toolkit, is like, developing, implementing patient satisfaction surveys, analyzing data, identifying trends, optimizing the scheduling and staffing. These are just examples of some interventions. When you go through this practice in the toolkit, you're going to be able to identify these interventions and then put plans into place to correct them. Okay, so we're going to pick 1 or 2 of these root causes to develop our aim statement. Again, the aim statement is a summary outlining your team's goals, the specific change you want to accomplish, and the period for achieving it. All right, next slide. So setting the clear aim statement, again, it's by, this is just an example, giving a specific time frame, like 6 months from implementation. The provider's practice will develop and implement a patient satisfaction survey to systematically assess their experience. The goal is to achieve, and let's say you want a specific percentage, like 20% improvement in patient-reported satisfaction scores related to wait times, provider attentiveness, and communication. The practice will use survey data to identify key areas for operational improvements, implement workflow changes, and establish an ongoing feedback loop to enhance patient experience and engagement. So this aim statement is basically a declaration that outlines the primary goal or the desired outcome of the project. So in other words, when you're doing your root cause and you're developing your aim statement, what are you trying to achieve, and by how much, and by when? And then again, referring back to the QA Basic Manual and the toolkit that gives you a lot of more information in this area. And again, when we designed this toolkit, it's really to bring your team together and work together step by step to develop the root cause, the clear aim statement, and so forth. Okay, next slide. So once you've determined your root cause and you've developed your aim statement, now you want to be able to form your team. And so who do you include in forming your team? Who should be there? Who's responsible for implementing change within your organization? Is it the clinical staff? Maybe it's administrative staff. Maybe it's your clinical manager or a physician, maybe even the nurse practitioner. So take a look at who's in your organization who would be responsible for implementing change, and you want to make getting them on your team. You're reviewing your purpose, and then consider the systems that are related to that purpose, and then ensuring your team includes mentors who are familiar with all the different parts of the process. And then list each team. Last is each team needs an executive sponsor. So basically someone who's going to lead the charge for this process improvement. And then you have your team members formed. And again, getting them together and teaching them the why. Why is it that we're getting together? Why is it that this is important? Why do we need a process improvement in this area? What are we trying to accomplish? And how we know when that change is an improvement, and what change can we make that will result in that improvement? And so taking a look, see who should be on your team, and don't be surprised. It could be some people that you hadn't even thought of that really make a difference. And it's a lot of times your frontline staff who are in the weeds with it, with that problem, and could be very important member to that team. All right, next slide, please. So now you have your root cause, you have your aim statement, where you want to go, you formed your team. What do you do next? So this is a structured approach for continuous improvement. It's the plan, do, checked, act cycle. And many of you are probably already familiar with it. Some places or providers will use PDSA, which is study. I just like this form with a check. The PDCA cycle instead, but it's widely used in healthcare quality improvement. The PDCA cycle provides a systematic way to identify the problems, test your solutions, and sustain successful interventions. So your first step is your planning. We already talked about that. It is all about identifying the problem, developing a strategy to address it. When applying the PDCA to your practice, it could include things like developing a provider patient satisfaction survey, which is the example we're taking you through. Increasing the percent of primary care patients receiving a single session intervention. One of your providers had shared implementing interdisciplinary team huddles. So again, the first step is identifying the problem, developing that strategy, and then the second step is to do. You're going to implement that phase. Implement the planned intervention on a small scale. Instead of rolling out a clinic-wide change, you might want to start small and use it in one unit or one department and test it. And before you spread it out to the whole organization. So in the during this phase, we're going to train staff on new protocols or new interventions. We want to launch the initiative, collect real-time data, and observe how the change is being adopted in daily practice and identify any immediate challenges. So again, the do is implementing the plan on a small scale. You're going to test it to make sure it's going to work. Because if it doesn't work, then we got to go back to the planning stage and kind of start over a little bit. And the next step is checking, analyzing those results. So you went through introducing it on a small scale. Now in the check phase, we analyze the data to see if the intervention is working. This involves gathering feedback from your frontline staff or your patients about what's working and what's not. You're conducting those rounds, you're completing audits, identifying unintended consequences or barriers. What were those barriers as you're checking through this process? For example, after implementing the patient satisfaction survey, the practice collected 3 months of data. They analyzed the key metrics resulted in the wait times, provider attentiveness, and communication. And then their findings were XYZ. And so it was working. So now they're acting out, and they're going to go to that last step, which is act. That's the act phase. We take what we've learned and we decide on next steps. If the intervention was successful, we standardize it across all the units or the entire clinic or the all offices. We identify the issues, we adjust the plan, repeat the cycle until we've achieved the desired outcome. And then when you have continuous monitoring, we'll ensure the improvements are sustained over time. And I'm going to talk about sustainment in a future slide, because I think that's really a key. Once you have identified, you broke it down, identified, started at the beginning, you put your PDCA in place and it's working, you rolled it out to the rest of the building or the rest of the provider practice, how are you going to sustain that? And so that's a really key to all of this too. You also want to refer to pages 6 through 10 gives more of the details on the PDCA cycle that you can reference to. I just shared with it on a very high level. All right. Next slide, please. So here, building a culture of continuous improvement. This is, like I said, this is the challenging part because it's keeping your eye on the ball. You know, when you've made these changes and you've gone through the PDCA cycle and you did all the training with the staff, and then 6 months later, did it fall by the wayside? Did we forget what it was that we were doing? Do we have to circle back around? So building that culture of continuous improvement is really key to having that ongoing success. So as providers and clinicians, we know that preventing negative outcomes and implementing best practices, but also about creating an environment where everyone from frontline staff to the leadership actively looks for ways to improve outcomes and safety every single day. Why does continuous improvement matter? Why is it important to you?
Job, finance, security.
Finance, security, patient safety. Those are all really good examples, because continued improvement should matter in your building and in your practice. It's not a one and done effort. Unfortunately, you know, the healthcare landscape is always evolving. If we don't continuously evaluate and improve our service strategies, we risk falling behind, and ultimately patient safety and the care will suffer. So, you know, having those things in the forefront of why continuous improvement matters is important. I always like in my practice, I always taught the why. You know, our staff know what to do, they know how to do the job, but do they really understand the why? Why is it important that you're having this root cause analysis done? And being able to educate and communicate and share that why, then everything else can fall into place, and that continuous improvement, it will just become second nature to your team. And again, it's not about perfection, it's about building the progress and one step forward every single day. When staff members feel empowered to identify their risks or suggest solutions to take ownership, we create safer environments for our patients. Liz, thank you for your comment. So we don't get stuck, and support our staff so team members and providers have greater job satisfaction. Very good. Absolutely. When you're completing your PDCA, it's important to highlight those positive outcomes and recognize the efforts that contributed to the success. You know, I'm all about the giving the shout outs and celebrating success. It's my personality. That's the kind of leader I was in my nursing home. And so giving shout outs to the team who are involved in the process, you know, and celebrating those successes all through the process. It just, you know, you focus on positive, you get positive outcomes, and continuing that with your team is sure to build that culture and have continuous improvement. The question is, how do we create that culture where improvement is not just a project, but a mindset? I leave you with this question, an action that you can take this week to strengthen the culture. What one thing could you do to strengthen that culture of continuous improvement in your clinic or practice? Any thoughts here? So we'll leave that as homework for you, about when, because you will be getting some homework for the next before the next session. And when you're taking yourself through these processes and these steps, you know, what action can you take to strengthen that culture of continuous improvement in your clinic? Love to hear your thoughts on that. Goal setting. make a suggestion box. Actually, Chris, that's a great idea. I'm actually doing that with the community that here in Honolulu about they have grievance issues, and so we put together a suggestion box, and we called it the cause for applause, cause for concern. Through their root cause analysis, we determined, that they needed a better way to communicate. Their patients needed a better way to communicate to its leadership about their concerns and their grievances. So we created a suggestion box. We got them off Amazon. They were pretty cheap. We placed them in all the different office spaces. We created these little 4x6 cards, and on one side was cause for applause for the team, and on the other side was cause for concerns. And so we just implemented that process and that program. So I'm anxious to see how the results come out through the PDCA cycle. We're going through that now, and the suggestion box seems to be filling up. Every morning they have, and we did a positive spin, right? We did the cause for applause, but also cause for concern. So we're getting a mixed bag. We're having some cards, the patients are being very positive and giving positive feedback about their experience in their practice, but they're also seeing cause for concerns. And, whether it's a wait time or how the provider had the patient doctor experience together. And so it's exciting that it's working, and now they're going to be able to take these data now, because they're now coming back in, they're able to take a look and see, but they're celebrating success by sharing these cause for applause cards. And at the same time, they're looking at the concerns and they're root causing and coming into solutions and to fix those. One of the things that they're also doing that will be interesting to see how it comes out in their data is that they're doing a 24-hour response time. So we'll see how that works. In 24-hour response time as part of their root cause, they get a cause for concern. They're taken within 24 hours and responding to that patient and digging a little bit deeper about that concern and trying to find resolution for those for that patient within that 24-hour time period. So we'll see how all these works out with this practice that I'm working with them on. So, but yeah, suggestion box, Chris, is a great idea. I think this community that I'm a provider that I'm working with will turn into some positive results for them and outcomes in the long run. Great. Melinda, thank you. You said goal setting. I think goal setting is very important. If you don't have a goal, how do you know you achieved where you need to go? And, and having the entire team involved in that process for setting those goals is essential. And I would, when we meet again in a couple of months, I think these meetings are every other month. You'll have some homework that we're going to give you for the toolkit. And I'd love to hear back in a couple of months, what worked, what didn't work, and what roadblocks did you come into? What barriers did you hit when starting at the beginning and breaking down those barriers and seeing what those root causes are? And then what were some of your successes? Next slide, please. So as I mentioned, you have some work to do. So in this toolkit, if you guys, do you have it there in front of you? You do? Okay. So in this toolkit, the very first the first section was Introduction to QI. In this presentation today, I talked about what is it, what are the key principles of quality improvement. Again, it's patient-centered focus, involving the people who do the work, having a structured approach, testing your changes. And then it goes on into page 2 about getting started. And I think one of you mentioned, that's maybe where the biggest struggle is starting at the beginning. And so developing your call to action and what is that problem, you want to be able to identify that specific issue you want to address. So we could do this together as like a workshop. We do have 15 minutes left, and before we open it up to questions. Do you want to start and do a workshop together and kind of go through some examples of getting started where you're identifying your problems to help with, starting on page 2 and getting started and identifying, that beginning. What is it that your problem is? What specifically do you want to address? Let me start with Chris. Or Melinda. Oh, Melinda, thank you. So their problem is a no-show appointments and being late. Yeah, that can really jam you up, right? Because they come in late, then everybody else is getting behind, right? And that puts everybody else behind. Chris says we have a waiting list. Oftentimes patients don't respond to calls for scheduling. Okay. So let's go back to Melinda's challenge. It's a no-show appointment. And then the patient's being late to the appointment. So why is that? First of all, you have 2 problems there. Right? You have one that's not showing up for their appointments. They're just no shows. And then the second one is being late. So why is that? Why are your patients not showing up?
A lot of our no-shows are mental health patients, or they just call in the morning and then don't show up. It's annoying. And the late ones, they're just repeatedly late, and we continue to work them in the schedule, and it's a mess by the end of the day.
Repeatedly late. Okay. And why is it that they're late? Are they coming by public transportation, or they're depending on someone to bring them?
Ours is a lot of, we don't have public transportation in our small little town. It's just, I don't exactly know the why, but it's just, it's repeated offenders all of the time. And I think it's just because it's accepted and they just don't respect and value the provider's time and the staff's time. But I don't really know. There are a few, of course, that are transportation type things, but as the care coordinator, I help them arrange that. So there's really no reason for that. So I don't know.
So, okay. So so you know which patients are your repeat offenders?
Usually.
Okay. So when you're booking Jane's appointment, have you thought about banking in?
We usually tell them 30 minutes ahead of time.
Yeah, okay, that's what I was gonna say. So the appointment's at 10, you tell them be there at 9:30.
Yes.
Does that work?
No.
Okay.
But I don't know. At the end, I think this is kind of where I'm going to go with my QI project.
Okay.
I haven't quite got it all figured out yet, but at the end, I would like to have a policy in place of a cutoff time for acceptance, and also see if there's information out there if we can bill people for not showing up. Because in our small facility, we can't afford to have 5 out of the 8 appointments for mental health not show up that day.
Absolutely. I see that happening here in Honolulu. They will call me a day before my appointment. And if you cancel or don't show, they charge you. And they make it very clear in their policies. So unless you ended up in a hospital emergency room, they charged you for the full charge. So if that practitioner is $125 an hour, they would charge for late fees and non-arrivals. So I wonder if your state has laws against that. I don't know the answer to that, but that might be, I think you're right. I think you're on track and looking at, you know, if your root cause is, where you're unable to really find that true root cause of why they're late and repeatedly late, even though you set the appointment up a half hour earlier, throwing that out there might deter some of the late arrivals.
Yeah. And the other crunch that we have is a lot of our abusers of the process, unfortunately, don't have the income either. There are a lot of them that are struggling financially as well, but I don't know. So it's always a double-bladed sword.
Sure. And some of these patients, do they depend on others to get them to appointments?
Not a lot of times, actually.
Okay. So they have the transportation means to get to their
Mhm.
appointments. It's just they're coming late.
Yep.
Yeah, Chris, you're asking a good question. Do you have financial assistance?
We do.
Okay. Well, there's some good questions that are coming in here in the chat.
Mhm.
Can you do phone calls and make it a billable service?
Yeah, and
Okay,
I don't know what Montana's regulations are on that.
yeah. Well, and I know that that's a topic right now in Washington about removing telehealth services from Medicare and Medicaid. So more to come as they decide on that. Some places do charge a professional fee. Amy states that I have worked in places that after 3 no call no shows, they no longer schedule the client.
We do that as well.
You do
And
that
then,
as well? Okay.
mhm.
Chris states that 16 minutes in person is a billable service. Oh, Liz, thank you for commenting. So far, telehealth is still okay, especially for behavioral health services. That's good. So that's a good question, on part of your root cause for your late arrivals. Would it be easier to do them telehealth? Then they don't
Probably
have to get out of their house and come into the
mhm.
practice.
Some of them we do that with, but a lot of times it's trying to think of the words here, but the acuity is higher than
Mhm.
being able to be just at home.
I see. Okay. Okay. So let me ask you, what percentage of your patients are, what did you call it? Late arrivals, are repeatedly late offenders?
I would probably say anywhere from 20 to 30%.
Oh, that's pretty high.
Mm.
Okay. So through your aim statement, you could make something like you want to reduce that down to maybe 10% or something over the next 6 months. And then what steps do you want to take to reduce those late offenders?
Yeah.
Or late arrivals? And would it be instituting a new policy where they have to pay, or pushing them back to telehealth if that's possible? Different things, scheduling their appointment a half hour later, like you said. So let me ask you this. So if you're scheduling, so if their appointment's at 10, but you're telling them to be there at 9:30, what time do they typically show up?
Oh, it just varies, but sometimes they're still 2 or 3 minutes late, even if we tell them to come a half hour early. And there's always an excuse.
Yeah, I hear you. Okay, well, maybe one of the part of your PDCA would be then to schedule them, you know, tell them their appointment is at 9:20, knowing that they have the doctor's visits at 10. That gives them 40 minutes to get there.
Yeah, true.
I think, you know, with your, you know, form your team and see, you know, when you're forming your team, and it could be your front desk staff, your frontline staff, the practitioners, and developing that aim statement and the root cause. Developing your aim statement and figure out your plan. Definitely get their feedback and what might work. And maybe if your aim statement is to reduce it to 10%, identify those that you could drive change with. So out of the 30% of those patients, which ones would prove success for you in helping drive change into getting them there on time? And then focus on that group with your PDCA cycle, and see if you are successful in bringing that group in where they don't delay the practice by coming in so late.
Sounds good.
Yeah, I challenge you. I mean, I'm not sure if that's, you know, if I'm helpful at all, but I you know, being late, I definitely backs everybody up, and it's 6 o'clock and everyone wants to go home, and you still have patients in the waiting room. And so, yeah, I'd like to see by next meeting how that worked for you, forming your team and you know, focusing on those late arrivals, and I hope that works for you.
Thank you.
All right. Anybody else have? This is really great. I love when we do interactions like this. Some other comments in the chat. Michelle says often those are the patients who need care coordination the most. So I'm thinking outside the box about how to reach those in very small communities. Challenges are. I'm sorry?
I'm the care coordinator too.
Oh, okay. She's saying challenges are reimbursement and getting the patients to buy into the care that can help them. Yeah, I get that. Okay. Chris also asks, does the appointment reminder have a different time than the time you told them to be there?
That I am not sure what the front desk does, to be honest. I have to look into that.
Okay. Yeah, those are some really good suggestions. Again, thinking outside the box, and, you know, if we focus on that 10% of your late arrivals with your team and how they can finagle their time, you know, their appointment time, so that they actually show up on time. I'm excited to hear back from the next meeting how this all works for you. And, you know, yeah, no, I like to be positive, and I think that there's opportunities there, and, you know, and you've got a great group here. And then at the end here, we're going to give you Marcy's and my contact information. So if you want some more one-to-one direct assistance to bounce things off, you know, you'll be able to reach out to us as well and try to come up with some solutions to those challenges. So,
thank you.
All right. I think the next slide is just about questions. What questions might you have? But you have your marching orders of your work to do. So you're going to define your problem. You're going to form your team. You're going to do your root cause. You're going to set that aim statement, and then develop that plan of correction, and then plan to report out at the next meeting in what worked and what didn't work for you. Any questions you have for me?
It looks like Liz has her hand up, Jolene.
Okay.
Yeah, I just raised my hand because I want to really clarify. Are we asking folks to complete steps 1 through 3 on page 3 of the toolkit? and then
Yes.
comes to the next webinar prepared to report out on that.
Yes. And if they want,
Okay.
if they want to take it further and take it all the way up to the PDCA, they definitely go for that. Otherwise, what we want them to do is kind of define that problem, do the root cause, find out the why behind it, and create that aim statement.
I think we should bite it off in that chunk for the next webinar so that
Okay.
people feel really confident about the problem they're seeking to address, the steps to setting the goal and developing that aim statement, and then getting some feedback on that if that works for you guys.
Yeah, definitely. You guys all good with that on the call?
Sounds good.
Okay.
And I
All
just want
right.
to emphasize what Jolene said, the importance of forming your team. And while we understand that not everybody will be able to attend each of these webinars, we do really want you guys to ensure that it's not just one of you trying to lead this effort or complete this QI project on your own. We really want you to make sure that you have a teammate in your clinic or practice who you are working on this with together. So we will post the recording and the materials on our resource hub so that that teammate or teammates can watch this if they weren't able to attend today. And so you can share those resources with them.
And then the next webinar, mark your calendar, is Tuesday, April 22nd at 12 to 1 o'clock Mountain Time. So we really want to get some feedback. You see here on the slide, we have an evaluation. I'd love to get your cameras out, scan that QR code. I think it's a simple 3 or 4 questions that Liz had for you to complete on today's session. And would love to hear your feedback, what worked, what didn't. And so we are ready for our next meeting coming up in April. I think, Mainette, do you also have the QR, instead of the QR code, do you also have the link that you could drop into the chat, just in case someone doesn't have their phone? Okay. If not, Liz, you have the link on that. You can mail it out in case. All right. And then the next slide just has Marcy's and my contact information. So if you would like more virtual one-to-one coaching assistance, you can contact us. Our emails are listed right there. And I can also drop them into the, Marcy, if you want to drop them into the chat too.
Yep, I will throw them in chat.
Okay. And then Liz also dropped the evaluation form into the chat. So we really do like your feedback. So encourage that. It is anonymous feedback. So if you could complete those, I'd appreciate that. Any other questions? I hope that you found today's session helpful in, just again, it was a lot of content, but I wanted to kind of just share about, how we break down and look at, what the problem is and break that down into a root cause and developing that statement and forming your team. And so I look forward to getting back with you folks in April and see how things have progressed for you. Any other comments in the chat? Marcy, Liz, any other additional comments? We have 5 minutes left in today's session.
Nothing here. Thanks, everyone. Great discussion, great feedback. And again, as Liz mentioned, we'll get this recording out to you, as well as, we have a PDF of the slide deck as well. So that's all forthcoming.
Thanks, everybody. Have a great day.
Thank you.
Thanks,
everybody.